Welcome back. There's a health alert for water-loving residents. The Department of Health and Hospitals is warning swimmers and fishermen about a flesh-eating bacteria that can be found in any body of salt or brackish water. As one Gonzales man found out, an infection could cost you a limb or even your life. A word of warning, if medical procedures make you squirm, now might be a good time to look away. The weekend of June 9th was meant to be all sun and fun at Grand Isle for Richard Gary and his family.
Catching crabs and shrimp in the surf and enjoying exactly what Grand Isle is about.
However, things took a bad turn after Gary fell while fishing on some of the rocks and cut his left leg.
Came back in, cleaned it up real well and all that, went back out, did a little fishing. Thought I'd probably sprained my ankle very badly, and it started to swell a little bit.
A trip to Our Lady of the Sea Hospital confirmed an injured ankle. But Gary had no idea that the real danger was in the cut itself. A bacteria called Vibrio vulnificus was already eating away at his skin and releasing dangerous toxins into his body. Within 48 hours, he was in septic shock and was rushed to the hospital a second time.
I was at the precipice. I could feel it, and you knew that you weren't for this world much longer.
Doctors were able to stabilize him enough to get him to the Terrebonne Hospital, where he had 7 surgeries to remove the infected tissue. He was left with a gaping wound.
I just remember the shock, but I also remember the happiness because I knew then that I had a chance of saving my leg.
Now Gary is being treated with hyperbaric therapy at Baton Rouge General Hospital.
When patients are getting hyperbaric oxygen therapy, they're subjected to an atmosphere that's pure oxygen and twice the normal pressure of oxygen. And that boosts the levels of oxygen in their blood and body tissues by up to 15 times. So, I mean, it's a huge increase.
The boost in O2 stimulates cell regrowth and healing. It also suppresses bacteria, which cannot thrive in oxygen-rich environments. In a month, Gary's wounds have healed significantly, and he will soon be ready for a skin graft.
He's lucky to have even survived.
As for the bacteria Vibrio, it is naturally occurring in all bodies of water, and infections are rare. However, as bacteria levels increase with warmer weather, officials urge everyone to be diligent and cautious of any open wounds. Gary says he won't stop fishing anytime soon.
No, but it will make me more cautious.
Again, most people in good health can enjoy the waters without much worry. Those with weak immune systems are at more risk for any infection. The DHH does monitor the water each week. Those results are posted online, and you can find a link on WAFB.com.